So how do you present polarized lenses to patients? The key is to have a system in your office. It starts with these underlying principles. Number one, patients need at least 2 pairs of glasses, an indoor pair and an outdoor pair. Number two, you want to educate 100% of your patients about the benefits of polarized sunwear. Number three, everyone is a good candidate for polarized lenses. Number four, all patients are coming to you wanting the best treatment plan. And number five, if you don't present polarized lenses, there are major optical players just waiting to aggressively pursue your patients. And now let's preset patients to purchase. One of the most powerful practice management concepts I've learned in 30 years of practice is to preset patients to purchase. Presetting is the difference between helping patients buy and trying to convince patients to buy. It's much easier to help patients buy. So here's how you do it. Start with your pre-exam telephone call that your staff makes to remind your patients of the exam coming up in a day or two. Add one sentence to that phone call. And don't forget to bring in your driving sunwear. Most patients will respond with, "I don't have driving sunwear." That's okay. You've planted the seed. Now when they get into their car and drive in the sun, they'll be thinking, "Oh, if I just had driving sunwear." Now when they come into the office, they're ready to talk about driving sunwear rather than having staff need to convince them that they need driving sunwear. Walk through your office as if you were a patient. Every place the patient stops, you stop. In these stopping places, you want to put presetting marketing messages that help the patient self-diagnose that they have a problem that can be fixed in this office. Use messages that identify patient pain points, such as, does glare bother you when you drive on a sunny day? Are you as safe as you should be when driving? Put these messages on the walls, on computer monitors, and in messages hanging from the ceiling. The next step is to utilize your pre-exam history questionnaire to further preset the patient. Make sure there are questions such as, do you experience glare when driving, fishing, skiing, playing sports, or gardening? Are you considering sunwear today? Are your current sunglasses polarized? Here's nugget number 3. Script out your case presentation. Think carefully about the questions you present to patients during the case presentation. Try to pose your questions so that the patient responds with a series of yes answers, so when you ask for the purchase, the patient continues with a yes answer. It's harder for someone who's been agreeing and answering yes to say no. The next step is the case presentation. In the case presentation, always present sunglasses before dress glasses. And in the exam room, the doctor needs to prescribe polarized lenses for the patient. The best and easiest way is to always relate it back to the patient history. For example, Mrs. Smith, when you came in today, you told me on the history form that you're experiencing glare when driving. Continue by saying, the difference between wearing polarized sun lenses during daylight driving and just wearing regular sunglasses is 23 feet. Studies have shown that a driver going 50 miles per hour wearing polarized sun lenses will react faster and stop on average 23 feet sooner than a driver just wearing regular sunglasses. 23 feet. That's about the distance of an average intersection. I wear polarized lenses when I drive, and here they are. I'm prescribing Xperio polarized sun lenses for you. Here's a case presentation based on eye health. Mrs. Jones, you told me today that cancer runs in your family. Did you know that up to 90% of all skin cancer occurs in the vicinity of the head and neck? Did you know that 5 to 10% of all skin cancers are on the eyelids? Protective polarized lenses block the sun's harmful UV rays. I wear polarized sun lenses, and here they are. We need to reduce your risk. I'm prescribing Xperio polarized sun lenses for you. Tailor the case presentation to the patient history and end with the statement, I'm prescribing Xperio polarized sun lenses for you. Here's another practice management tip. People don't buy features, they buy benefits. Always talk to the patient first about how polarized lenses will improve their life by making them safer driving and making them more comfortable in the sun. Most people make an emotional decision to buy based on how it will improve their life. Then, after making the emotional decision to purchase, they look for factual information to back up the buying decision. That's when either you or your staff hands the patient either a fact sheet or a brochure on Xperio to support their buying decision. Make sure you have brochures and printed materials to use with the patient to reinforce the emotional decision they've already made. The next step occurs in the optical. Make sure to demonstrate polarized lenses to the patient. There are many ways to demonstrate polarized lenses. The key is to do it. The show and tell presentation puts reality to the exam room discussion. The more reality you can give the patient, the easier it is for them to see themselves using polarized lenses to improve their lives. We learn by seeing, by hearing, and by doing. When you demonstrate polarized lenses to patients, you are helping them learn by seeing, by hearing, and by doing. Offer at least a 35% discount on second pair sales. Research tells us that patients are more willing to accept a second pair when offered at a discount of at least 35%. Make sure you have a multiple pair discount that is at least 35%.